Hello, Dr. Dilip Gude here, physician, Somajgoda Yashoda Hospital. We'll discuss about diabetic foot. Basically, what is diabetic foot? In a diabetic patient, if there is an ulcer that is non-healing, it's not healing adequately in the appropriate time, say in 5 to 7 days. If it is there for a long period of time, say for example months, and it's not healing, then there is a high chance that this particular patient may have this condition called diabetic foot, where there is decreased blood supply to the legs, and then in fact there is neuropathy also. So when there is severe diabetic neuropathy, patients don't feel the sensation in the sole basically, and when they keep walking under say soil or any ground where there is a micro trauma, when there are small stones that may cause some degree of injury, but since they have decreased tendency to get these senses, to understand the sensations, then there is a high chance for them to have injury and trauma. So this will increase the chances of getting minute ulcers, which may actually become a full-blown ulcer, and then may lead to cellulitis or even gangrene. So in diabetic patients, especially due to neuropathy, due to numbness, these ulcers, they don't heal pretty fast. One more important reason why ulcers don't heal well, apart from poorly controlled sugars in diabetic patients, is the decreased blood supply to legs. So that is because of increased cholesterol plaque deposition in the legs, which hampers the blood supply to the legs, and that's how the diabetic foot, the ulcers in a diabetic patient in the legs, they don't heal fast. So when there is a non-healing, chronic non-healing ulcer, we need to first look at how the blood supply to the legs are, especially the arteries. We know that there are veins and arteries. So when there is blocked veins because of thrombi, we call it a deep vein thrombosis. And of course, that also needs to be treated. We need to give blood thinners and make sure this thrombosis is lysed, and then blood supply is re-established, and deoxygenated blood can be flown back to the heart. Likewise, the arteries take the oxygenated blood from the heart to the legs. So when arteries get blocks in them from cholesterol plaques and all, then the blood supply to the legs of the arteries of the legs comes down drastically. So we need to quantify it. We need to see how to what degree these blocks are, and CT peripheral angiogram is another test that can help us pinpoint as to where the blocks are and how bad the blocks are. If the block is say beyond 60% or more, the patient might benefit by having a stent placed and re-establish the blood flow. But if the disease is entire artery, if it is even in the distal area, in the towards the leg area, then the stents might not really help, because the disease is entirely diffuse, and even if you put one stent, it won't really help increase the blood supply back. So, and in some particular conditions, you may even be required to do a bypass graft, where you can bypass 2 or 3 blocks and re-establish blood flow distally to the feet. So it is really important, once you get an ulcer, and if you are a diabetic, first make sure your sugars are very well controlled, your blood pressures are very well controlled, make sure you're on a high dose statin, either rosuvastatin or atorvastatin, and then make sure you're on a blood thinner medicine. And then this ulcer needs to be debrided. We have to make sure the bad pus needs to be whatever the bad tissue that needs to be debrided, and this pus from it must be sent for culture and sensitivity. This will tell us what kind of bacteria is there in that particular wound, and what kind of antibiotics is it sensitive to. So once you understand this, you give the appropriate antibiotic, you treat and make sure the bacteria that's growing, even if it is multi-drug resistant, based on the antibiogram, you can give the antibiotic and make sure the bacteria dies, and then re-establish the blood flow with all these medications. If required, stenting. And of course, neuropathy also can be reversed to some extent, some 20%, by giving medicines like methylcobalamin, alpha-lipoic acid, and sometimes pregabalin and gabapentin, etc. So when you go for a holistic approach with the help of a diabetic foot surgeon, your diabetologist, a physician colleague, then it is possible if you seek help in the early on stage. You can definitely combat and fight diabetic foot and make sure it won't progress towards wet or dry gangrene, which may eventually require amputation as well. So this amputation can be below the ankle or even above the ankle. So that is how we approach diabetic foot. So kindly do not take the ulcers in the feet lightly. Get help as fast as possible. Thank you.